Nutrition refers to the study of how food nourishes the body and affects overall health and well-being. It involves the intake of food and its digestion, absorption, and utilization by the body to maintain optimal health. Optimal nutrition provides for daily body requirements and support increased metabolic demands. Macronutrients. Macronutrients are nutrients required by the body in large amounts for energy, growth, and repair. They include carbohydrates, proteins, and fats. Carbohydrates are the body's primary source of energy and are found in foods such as fruits, vegetables, grains, and sugars. Proteins are essential for growth and repair of tissues, as well as for maintaining immune function. They are found in foods such as meat, fish, poultry, beans, and dairy products. Fats serve as a source of energy, insulation, and cushioning for organs. They are found in foods such as oils, nuts, seeds, and fatty meats. Micronutrients. Micronutrients are nutrients required by the body in smaller amounts for proper functioning of various physiological processes. They include vitamins and minerals. Vitamins are organic compounds that are necessary for growth, development, and metabolism. They are found in foods such as fruits, vegetables, dairy products, and meats. Minerals are inorganic compounds that are essential for proper body function, including bone growth and maintenance, fluid balance, and nerve function. They are found in foods such as dairy products, meats, grains, and leafy vegetables. Factors influencing nutrition vary, and it is important to consider the social determinants of health when assessing patients. Social determinants of health are 1. Genetics. 2. Behavior. 3. Environmental and physical influences. 4. Medical care. 5. Social factors. Environmental factors. Availability and access to healthy food options. The accessibility of healthy foods can influence dietary choices and intake. Food deserts and food swamps. Areas with limited access to healthy food options or a preponderance of unhealthy options can affect dietary intake. Cultural and religious practices. Certain cultural and religious practices may influence dietary choices and preferences. Food labeling and marketing. Food labeling and marketing can impact the perception of healthy food choices and influence dietary intake. Genetics. Age. Nutritional requirements may vary based on age, with different nutrient needs for infants, children, adults, and elderly individuals. Infants, during the first year of life, breast milk or formula provides all the necessary nutrients for optimal growth and development. It is important to ensure that infants receive the appropriate amount and type of nutrients for their age, including sufficient iron and vitamin D. As children grow, their nutrient requirements change. It is important to ensure they receive a balanced diet with adequate nutrients, especially calcium for bone growth and development, and iron for cognitive development. Adolescence. During adolescence, rapid growth and development occur. Adequate intake of nutrients such as protein, calcium, and iron is crucial during this period. Adults. Nutrient needs remain relatively stable during adulthood. However, it is important to consume a balanced diet to maintain optimal health and prevent chronic diseases. Elderly. As we age, our nutrient needs may change due to changes in body composition and reduced absorption and utilization of certain nutrients. Adequate intake of calcium and vitamin D is important to prevent osteoporosis and maintain bone health. Gender. Nutritional requirements may vary based on sex, with differences in nutrient needs for men and women. Women have unique nutrient requirements due to menstruation, pregnancy, and lactation. Adequate intake of iron and folic acid is important for reproductive health. Men have higher calorie and protein requirements than women. Adequate intake of nutrients such as zinc and selenium is important for reproductive health. Body size and composition. Nutritional requirements may vary based on body size and composition, with different nutrient needs for individuals of different body sizes and compositions. Larger individuals, larger individuals may require more calories and nutrients than smaller individuals. Physical activity level. Physical activity can influence nutrient requirements, with higher activity levels requiring increased energy and nutrient intake. Athletes may require higher calorie and nutrient intake to support their physical activity levels. Health status. Certain medical conditions may require modifications in nutrient intake. Medications. Some medications may interfere with nutrient absorption or utilization, requiring modifications in nutrient intake. Psychosocial or behavioral factors. Attitudes and beliefs about food and nutrition. Attitudes and beliefs about food and nutrition can influence dietary choices and intake. Emotional eating. Emotional eating can lead to overeating or undereating, which can impact overall nutritional status. Stress and coping mechanisms. Stress and coping mechanisms can affect food choices and nutrient intake. Social support. Social support can influence dietary choices and intake, with support from family and friends promoting healthy eating habits. Developmental factors. Nutritional requirements may vary based on sex, with differences in nutrient needs for men and women. Nutritional requirements may vary based on body size and composition, with different nutrient needs for individuals of different body sizes and compositions. Developmental risk factors and considerations. Prenatal nutrition. Adequate maternal nutrition during pregnancy is essential for the growth and development of the fetus. Poor maternal nutrition during pregnancy can lead to adverse outcomes such as low birth weight, preterm birth, and developmental delays. Early childhood nutrition. Early childhood is a critical period for growth and development. Poor nutrition during this period can lead to stunted growth, cognitive deficits, and chronic diseases later in life. Adolescents. Adolescents are at risk of developing poor eating habits and engaging in unhealthy behaviors such as dieting, skipping meals, and consuming fast food. This can lead to nutrient deficiencies, weight gain, and increased risk of chronic diseases. Now, let's move on to the assessment of nutritional status. There are several ways to assess an individual's nutritional status. One method is anthropometric measurements. These are measurements of body weight, height, and composition, which can help assess nutritional status. Body mass index, BMI, is a commonly used tool to assess weight status, calculated as weight in kilograms divided by height in meters squared. A BMI of 18.5 to 24.9 is considered normal, while a BMI below 18.5 is underweight and a BMI above 25 is overweight or obese. Another method is biochemical assessments, which involve measuring specific nutrients or metabolites in blood, urine, or other bodily fluids to assess nutrient status. For example, iron deficiency can be detected through measurement of serum ferritin levels. Clinical assessments involve physical examination and assessment of signs and symptoms of nutrient deficiencies or excesses. Medical history. Obtain a detailed medical history from the patient, including information about any past or present illnesses, surgeries, or medical conditions that could affect nutrient status. Inquire about dietary habits and any food allergies or intolerances that may impact nutrient intake. Physical examination. Perform a physical examination to evaluate for signs of malnutrition or nutrient deficiencies. This includes assessing for signs of poor skin health, hair loss, nail changes, and oral health issues. Lastly, dietary assessments involve evaluating an individual's dietary intake through various methods, such as food diaries or 24-hour dietary recalls. This can help identify nutrient deficiencies or excesses in the diet. Finally, let's summarize what we have learned. Nutritional status plays an important role in overall health and well-being, and developmental risk factors and considerations must be taken into account when assessing and providing nutrition. Environmental, individual, psychosocial, and developmental factors can influence dietary choices and intake. Healthcare professionals can use this information to develop targeted interventions to improve nutritional status and promote overall health. Thank you for watching. and please consult a healthcare professional for personalized nutrition advice.